Welcome if you're watching on onespotmedia.com. We begin this evening with another crisis brought on by the recent spike in COVID-19 cases. First, hospitals across the island have been struggling to cope with the unbearable number of COVID cases, and now the nation's morgues trying to cope with the rise in COVID deaths. Funeral home operators say the high number of COVID-19 deaths and the no-movement days, which reduce the number of days for burials, are putting a huge strain on their operations. Now, we must caution viewers that this may be a difficult story to watch. However, TVJ News felt it important to illustrate the gravity of the current situation. Here's Shamela Pullen.
Outside the Honeygan's funeral home in Westmoreland, a new storage facility has arrived. This is where the bodies of some of the people who died from COVID-19 will be stored. This because the storage inside the funeral home is nearing capacity. The workers seen here are trying to make space, a task which takes some level of creativity and precision.
We are transferred from one fridge to the other. We don't want to mix the COVID with the others dead.
Okay.
So we are look, if none in our fridge also, a COVID, then we remove all COVID to COVID fridge. And normal dead to normal fridge.
Oh, so now you have to clear fridge just for COVID?
Yeah, yes, just for COVID dead. The worst, never say.
Tell me about it.
But a wicked.
Why you say the worst?
But the amount of people have died through COVID, we want to know what going.
So you get called for like what? Pick them up at the hospital or you just...
Both yard and hospital. Both yard and hospital. But hospital is the most you pick up COVID.
Owner of the funeral home, Melvin Honeygan, says the situation in the West is unprecedented.
When we sit and look, we have numerous amounts of wives and husbands, brothers and sisters, mothers and daughters to be buried together now. And when I turn around also and I listen to my friends, so many of my friends are going to sleep with the Lord. Last week, we had to go to Falmouth 4 days in a row to pick up remains. And most of these bodies are COVID bodies.
And the lockdowns are not making it any easier, as several burials have had to be pushed back.
The time frame that we are now being given to burial, I think is rather rough and tough. I don't know how we are going to manage. Remember now we have moved from Monday to Friday up to Wednesday to Friday. So that has now creating more chaos.
The funeral home has also had to double up on personal protective equipment.
In the early stages, I said I could not handle them because we did not have any equipment. But we are now equipped and material, PPE, are locally available in Jamaica now, so we can have much more ease to go with it.
Other funeral homes in the West are facing similar challenges, but when we reached out to them, they declined to comment on camera. The country has so far recorded more than 1,000 COVID-19 related deaths. It is hoped that with the increased interest in vaccinations and the current lockdowns, things will slow down soon. Shamela Pullen, TVJ News.
Now, a couple of high school football coaches are worried that any decision to mandate COVID vaccines for high school students would have a negative effect on their teams. But as we'll hear in this report from Jordan Fort, one highly qualified medical doctor doesn't believe there is enough scientific evidence to mandate vaccines before high school students can return to in-person learning.
The government is currently on a drive to vaccinate high school-aged children against COVID-19 with a view to resume in-person learning on a wide-scale basis by October. And the Education Ministry recently announced that it will give priority to vaccinated students to return to the classroom. But if it gets to the stage where inoculation becomes mandatory, high school sport would naturally feel the effects. This was President of Intersecondary Schools Sports Association, ISSA, Keith Wellington, speaking on Hits 92 FM's Sports Grill recently.
one thing we're certain is that no one has a divine right to participate in any officers' competition. So if the rule at the moment says that you cannot be in school for face-to-face activities unless you are vaccinated, then I really can't see how we could explain allowing persons who are not vaccinated to be on the playing field with these same students.
But head coach of Holy Trinity High School's football team, Devon Anderson, says such a scenario would be devastating for his team.
If it should go the way of the president had said, in terms of the minister said that, you have to be vaccinated in order to play. I know a number of players that I am preparing are looking forward to prepare. I know they will go out because their parents share that. No way.
Coach of 2019 Ben Francis Cup champions BB Coke High, Kemar Ricketts, has similar concerns.
Some of the parents agree, and this from my personal team. We're over 70% vaccinated already, but I've still lost players who is against being vaccinated.
Neurological surgeon Dr. Roger Hunter is not in favor of mandating COVID vaccines for high school children, saying there is just not enough evidence at this stage.
We recommend vaccination, but we certainly do not see the evidence at this time for it to be mandatory. In terms of sports, again, children who are in sports are not going to be the super spreaders, certainly not with outdoor sports, and we have just not seen the evidence of that.
So where do other stakeholders stand on the issue? Opposition spokesperson on education, Dr. Angela Brown-Burke, just last week urged the government not to go the route of mandating vaccines for face-to-face classes. The Jamaica Teachers Association, JTA, has a similar view. President Winston Smith told TVJ News last week that he would like to see the government resume face-to-face classes with strict COVID-19 protocols in place, even for those who are unvaccinated. The United States-based Pfizer vaccine is the only one recommended for children as young as 12 years old by the U.S. Centers for Disease Control and Prevention, CDC. Jordan Fort, TVJ Sports.
Thank you, Jordan.
Welcome back to Primetime News, and a special welcome once again if you're watching online at onespotmedia.com. We begin this evening with a Primetime News follow-up. Hospital workers and patients are now breathing a bit easier as Jamaica received oxygen supplies to replenish the depleted stock at health facilities. Hospitals in Western Jamaica were among the worst affected. Although they have now received supplies, it may only last a few days. It was a frightening situation at hospitals on the weekend, with little or no oxygen at some facilities. Sometime after 1 Monday morning, medical-grade oxygen from overseas reached our shores.
So we now have bulk supplies, and it is now being distributed throughout the trade.
This morning when I reached the hospital, I speak for Corner Regional, we have had 94 cylinders that was distributed to the areas that require oxygen, and I was told reliable that their bulk source is coming from Kingston to replenish our bulk source.
Clinical coordinator for the Western Regional Health Authority, Dr. Delroy Frey, confirmed that the bulk source reached Falmouth, the Cornwall Regional and Savannah Lamar hospitals late Monday afternoon. There has been an increased demand for oxygen at hospitals as the number of COVID-19 patients have surpassed available bed space over the past month. It's understood that doctors and nurses have had to find creative ways to keep patients alive with the limited oxygen.
Believe me, there are some very ingenious methods that were used in order every day we have to reassess what we have and to see how we deal with this situation. And I'm happy to say that we manage this as best as we could under the circumstances.
With positive COVID cases and related hospitalizations still increasing, the oxygen demand will not be easing anytime soon. Dr. Frey says Monday's supply will alleviate those concerns for at least the next 48 hours.
We're going to ensure that these areas, once we get the supply from IGL, will be constantly replenished so that we don't go into any deficit as it concerns oxygen anymore.
The health minister says another shipment of oxygen is expected later this week.
We just have to plan accordingly because the quantities run out quickly. A big part of it is importation, getting it from the sources around the world because everybody has a demand issue. But I can say that we're past the worst now, at least for the time being.
Well, Welcome back to Primetime News, and again a special welcome if you're watching on onespotmedia.com. Up first this evening, would you be willing to pay a fee to get vaccinated? Well, Western Jamaica today saw the start of an initiative where persons can get the jab for a little over 1,000 Jamaican dollars. Shamala Pullen has details.
It's a vaccination drive with a twist. For $9 US, tourism workers and their families can get AstraZeneca, Pfizer, and Johnson & Johnson vaccines.
This is a private initiative, and as such, there is a cost to it. But most of our member hotels have agreed to pay for the vaccinations for our staff. I believe it's part of the vaccines that have come in through the government, and the government has made them available. I think where the cost comes in is administering of the vaccine, because I believe it's private nurses and doctors and so forth, and it's a private initiative, so there are costs associated. So based on that, we thought it was a fair price to pay for the convenience.
The national vaccination blitz has been a logistical nightmare for the government. It has been a turnoff for many who want to take the vaccine but are not prepared for the inconvenience of the long lines, long wait, and the crowd. We put to the Health Minister, Dr. Christopher Tufton, about the inclusion of private doctors to administer the jab in their office. The calls have been getting louder for this to be done, given that the country has been receiving more vaccines.
A number of what I've said will involve private doctors, but it will mean bringing the vaccines closer to where the people are. As it relates to a private doctor's office, they have to meet certain requirements. For example, the vaccine has to be kept at a certain temperature. Not all private doctors' offices have the appropriate refrigeration to maintain the integrity of the vaccines. Those that have gone through the training in over the recent weeks, as part of that training, would have that kind of requirement. And once they meet that requirement, because it also involves inspecting those facilities, then they will be given the opportunity to administer the vaccine.
In places like Negril, where residents from Westmoreland and Hanover depend heavily on tourism for their livelihood, getting vaccinated is seen as important, as the tourism winter season is just a few months away. Like many other industries, there is hesitancy, but that appears to be changing.
Well, there's so many rumors in the air, so I did want to do my research, to see if, whatever they're saying, what is true, what is not true, then I make up my mind.
Well, we hear all sorts of different stories, and, but to what is going on now.
What really pushed you?
Well, deaths, a lot of deaths.
I've made this step because a lot of persons that I am familiar with has died through COVID. So it put me at the edge of my seat. So I made the decision.
This private sector-led initiative continues in the coming days and will include locations in Montego Bay, St. James, and Ocherias in St. Anne. Reporting from the resort town of Negril in Westmoreland, I'm Shamala Pullen for TVJ News.